our goal is to help you save your dog's teeth and possibly the dog's life. So that starts with the fact that this disease, this is from a veterinary office actually, and what it says is that the bacteria associated with periodontal disease may damage the kidneys, liver, and heart. Daily brushing and professional dental care at regular intervals help promote oral health, longevity, and we have a model here that shows what you can do with healthy teeth and what happens when you're not brushing your dog's teeth and all the disease that happens. And what happens is they get abscesses then, and those abscesses, the bacteria gets into the bloodstream and can affect their heart, and actually there have been reports of death from gum disease. And plus your dog's in pain and loses teeth, and it costs you a lot of money. And there's really a simple step to stop it. And Dr. Marone does that, and we'll show you her dog who's 5 years old and teeth are perfect. And the way she does it, she brushes the dog's teeth a couple of times a week. Is that correct?
Correct.
Yeah. So that's all you need to do. About twice a week will do it. It's not, because the bacteria take really about 36 hours to regrow, and if you brush them twice a week, that's going to work. Because think about it. Now, if you yourself only cleaned your mouth, well, you never brushed your teeth, never cleaned your mouth at all, and you went in once a year or even less than that and had your teeth cleaned under general anesthesia, how would you like that? And what do you think the results would be? You would end up with lots of gum disease. And the general anesthesia that you're under, as you may know, actually can cause some cognitive problems in humans and in dogs, and an occasional death. There are reports of death from general anesthesia for dogs. So it's much easier if you just start cleaning your dog's teeth.